on a personal level, get a feeling of better health, and I've noticed specific benefits from doing Qigong and doing Tai Chi. I was a sufferer from knee pain because I had torn cartilage in both knees at different points in my adult life, and had surgery on both of my knees. And sometimes I would come into my class and have knee pain in one or both knees sometimes. And even after an hour of doing standing Qigong practice, the pain would go away. And I found that would happen over and over. And it just seemed, that it couldn't be coincidence that that sort of thing would happen, because in the past, before that, if I had pain, sometimes I would have swelling or pain for several days before it would go away, and yet here I was coming into class and it was gone in an hour. And I also sometimes came to class and I'd have a sore throat, or I'd have a headache or a stuffy nose, and after an hour of doing Qigong, those symptoms would be gone also. And as a psychiatrist, I've found that it's been very helpful in teaching patients a way to bridge the gap between conventional relaxation techniques, which are used fairly commonly in the field of psychiatry, to help people to overcome stress-related illnesses like headaches and muscle aches. And because a lot of people find it difficult sometimes to just sit still and do standard meditation techniques, but with Qigong they can move, and with Tai Chi they can move. So it actually teaches them that you can actually develop relaxation while you're moving, and that you can achieve a meditative state of mind while moving, which is very practical for people, because often people think that they can only be relaxed when they're sitting and meditating, and then they go about their daily activities and all of a sudden they lose all that relaxation because they've never learned how to move and be relaxed. Well, fortunately, there's a growing body of evidence, scientific evidence, that basically is showing that Qigong is having beneficial effects and Tai Chi is having beneficial effects for people who have various kinds of illnesses. There are studies that have been published. One that was a recent study that was published in Diabetes Care that showed that people who had diabetes basically had improvement in their laboratory values that are used to monitor their diabetes. There have been a number of studies with patients who have high blood pressure that have shown that by doing Qigong that they were able to lower their blood pressure, and by doing Tai Chi that they were able to lower their blood pressure. There have been studies with cancer patients that have shown that, that Qigong was a very promising form of alternative therapy that was being recommended and suggested as an adjunct or an adjunctive therapy in addition to their conventional medical therapy for cancer. And patients were finding that they had better quality of life. Cancer patients who were going under conventional medical treatment were combining that with doing Qigong exercises and finding that they were feeling better in general. And so I think there's a growing body of evidence that's suggesting that Qigong and Tai Chi have far-reaching benefits, probably farther than we even realize. Of course, the Arthritis Association is recommending Tai Chi as being the ideal exercise for people with arthritis, and there have been numerous studies that have shown that that Tai Chi prevents falls, which is one of the greatest hazards for senior citizens. And I've found that I've been able to use just the most basic Qigong exercise to help people who are in the middle of panic attacks in my office to recover from a panic attack in half or less the time that they would take if they were taking a medication by mouth. And so while I do use medication, as a doctor, I've also found that Qigong has been very, very helpful in helping people to achieve relief from anxiety-related problems just by practicing one technique continuously for 10 or 15 minutes. This technique is called Guanji Fa, and it's the first technique that we learned in Qigong. And Guanji Fa, loosely translated, means energy permeation technique. It also was explained to us as meaning impurity flushing and internal washing. So what you do is you just stand with your feet about shoulder width apart, and you turn the palms of your hands so that they face upward, and raise your hands and your arms as you inhale slowly. And as you do that, visualize in your mind that you're drawing in healing energy through the top of the crown of your head, and that as that happens, your hands then begin to turn the palms downward, and then you begin to exhale and bring your hands down the midline of your body. And as you exhale, you visualize that healing energy coming in through the top of your head and filling your body with golden light and relaxing all the muscle groups it passes and revitalizing all your organs as it passes down and takes all tension, all negative emotions, all negative sensations, pain, anger, fear, sadness, confusion, weakness, and fills your body with vitality and strength and calmness, and sends all the negative emotions down into your feet and out through the soles of your feet into the ground. And then just repeat that same exercise, inhaling slowly as you raise your arms upward, visualizing that healing energy coming in through the top of your head and glowing and just flowing through your body from your head all the way down, flowing through all your organs, relaxing all the muscles, revitalizing all the organs, sending all tension and all negative feelings of any kind down into your legs, down into your feet, and out through the soles of the feet and into the ground. I found that usually after 5 or 10 minutes that people who are beginners would start to feel more relaxed. And of course, more experienced practitioners oftentimes will start to notice that they start to feel more relaxed after the first 3 or 4 passes. In class, we would normally do this exercise in multiples of 3, customarily perhaps 9 repetitions, and then we would go on to the next exercise in Qigong. And there are many different kinds of Qigong. There's Qigong that can be done just standing, as we usually do in our particular style of Qigong that we practice in our school, the Hanyuan Qigong style. But there's Qigong that involves walking, and people will actually walk and do Qigong. And that kind of Qigong has been shown to be helpful to people, and there are people who were told that they were not going to survive cancer, and then 18 years later they're still practicing their Qigong.